Okay, this hamster is 2 years.
And 2 months.
Male, female?
It's a guy.
Male.
Yeah, male.
And when was that pus coming out from the ear?
Yesterday when I actually saw the pus coming out from his ear, and his eye also is a little bit closed.
Was there any fighting?
No, he's alone.
This alone?
But he has, actually I've always come here because he has had continuous eye infections because he likes to sleep on his urine. He has a habit of sleeping on, yeah.
Very
35.
Underweight.
so thin,
He used to be 66 grams.
35. He didn't eat, is it?
He's been eating very little ever since he got older. He used to eat a lot. Yeah, the previous time when we came here, he was around 50 grams.
50?
Yeah, 50 plus.
Average,
Yeah.
53. Was same name Drako?
Yeah, Drako. You did a surgery on him.
53 grams.
Yeah.
It was pretty good.
And before that, he was 66 grams.
53 grams was he had a tumour.
He had a tumour.
Then recovered.
Yeah, he recovered. He was okay after that. Then after that, he had skin issues. Then I came here again for the skin problems.
Is it because of the hygiene or not?
Yes.
The cage?
No, it's not. Because he sleeps on his urine. You see, it's only one side.
He sleeps on the urine on
Yeah,
the
he
right
sleeps
side.
on his urine. So it's only one side. The other side is okay. But one side, when he sleeps on his urine here, yeah, it's not very good. Yeah.
Was it the operational side? There was a
It's
side. Right neck and belly. Last time very itchy. Right neck
Yeah,
and
correct.
belly.
Yeah. That's the side.
So haven't solved his problem. Right
Yeah,
neck and
he's
belly.
he's
That was in
Yeah.
June 2016, you know.
yeah. You gave him his
And
ear drops also, which I put for him, and then
2016.
yeah, and he was okay actually. He was recovering.
Let's see. Okay, so it's an infection of the eye.
And then the ear also.
Ear, so below the ear, so the pouch. Or there's some, how's the pouch? Do you see any seed inside?
No, I have not.
Yeah, the pass into the eye, so it's
Yeah.
swollen. Last time the tumor was here, right?
Yeah, correct.
And it was okay.
Yeah.
So whether he bites or not.
Yeah, he's not very friendly when you pick him up like that. Yeah, I've never picked him up like that.
Okay, so how long already this been going on since June?
Yeah, no, his problem is like he recovers when he's on medication. Then after that, 1 month later, he's back, very bad condition again. Then he recovers and then goes back and forth.
September, no, it's September, right?
Yesterday, I actually saw pus from his ears, that's why.
Yeah, you can see a bit swelling below.
Yeah.
So we got to open up the ear canal to drain the pus off.
Okay.
Then hopefully the hamster will recover. There's another swelling here, there.
Okay.
Yeah, swollen compared to this side. So he's been scratching his ears.
Yeah, he has a wart, but
A what, right?
yeah, he actually has a wart here.
On the
Yeah,
left
but-
here.
Yeah.
So what does he eat now?
He eats those hamster meals plus one supplement.
The mealworms?
No, he doesn't eat any mealworms, yeah.
Those two.
I give him only carrots, broccoli, and then egg whites.
He eats a variety.
Yeah, he eats a variety every week. But he's been losing weight.
Yeah, due to the infection under the skin, under the ears. Well, the canal is closed up already. There, the ear canal.
Okay.
Need to open up. The pus is probably around here, spreading there.
Okay.
So that's why he lies on this side to relieve the itch.
Okay.
He might
Can
feel
his
very hot.
fur grow back?
Yeah, if he recovers.
Okay.
Okay. Finish it with just anesthesia and lance the abscess. October 4, 2016. This 2 months old
2 years.
male hamster called Drako has this problem of the right-sided inflammation, as you can see, and pus is seen coming out from the ear, as well as eyes also. Is the right eye is inflamed and is closed with pus. Now I came here in August, now it's September, and was treated for this same situation, skin disease. Now actually I checked the record, in fact in June, that was 4 months ago, he came in for this right knee subcutaneous tumour, which has been removed successfully, as there is no recurrence. Now, in fact, according to my drawings, he did have some right neck hair loss and itchiness as well as the lower belly, but he had never fully recovered, and so he came in August for treatment of skin disease, but it wasn't very much, it was just prescription of some antibiotics and wash. So now the owner says she saw pus come out from the ear, the right ear. There's a good clue, and of course the pus goes to the eyes becomes infected and closes up. So from what the owner says, the possibility is a vertical ear canal infection with the pus deep inside, and then this pus spills out and goes around the whole skin and under the skin on the right hand side, because this is the right ear, and of course some pus goes to the eyes and the eyes get infected. So you can see now the hamster is under anesthetic at 309 under 5% isoflurane gas, and so I'm waiting for him to sleep a bit. Then we will clip board first, clip away all the infected hairs, the whole side. So all everything get ready. As you can see, I've got everything ready. The sharp knife for cutting the right vertical ear canal, scalpel blade, and of course the hydrogen peroxide syringes. So don't be prepared everything in advance, because this is going to be a very short anesthesia, and you cannot afford to keep on putting the hamster under anesthesia again and again. He's already lost about 20 grams. It's already 53. That was in June, and he was even 60 over grams. Now it's 35 grams, you can see. Now, so we need a tray or what?
I'll shave first.
Okay, take out and shave already. Take out and shave already. Cannot wait until the fellow is fully down. Fully down is dead. Now you can see his back. You can see, not this side, shave the other side. I mean, there's nothing much on this side to shave. The other side, the good side. No, I mean, and those are the infected hairs. Faster than that, no, I'm talking about the other side. Shave the other side, because those hairs are contaminated. Faster a bit, because this anesthetic is not going to. I'm more interested in around the neck. It's waking up again, so we need to put some gas. The important thing is, yes, correct. So once he wakes up, we just put some gas, because we don't want to stress him out, and then he sort of passes away. Then just put it in again gas, so it's on off, facing upwards, of course. On off. And there is no real formula for it. Once you see him not moving, then out again. That's it. Few seconds will do. It's not as if there's a formula where you have to do for 10 seconds or what. Correct. So you get shaving off. The most important thing is the ear side, the front side, the cheek pouch side. The cheek pouch side. This clipper is sharp or not? It should be faster than that. Okay, on again, in again. Face upwards. So I'm getting ready. Once shaving is done, I will cut. I will swab, prep the area, cut. Now, as you can see, it's quite down already, so it's not that. Normally I say count up to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That's it. Take out, pour quickly, less than 1 second, and then get moving. Okay, just go to the front there, and then quickly go back to the other side. When that finish, in fact the whole body is inflamed. So you can see. Okay, go back to the other side. No, the other side. The right side before he wakes up. Any more hair to shave? No more. Correct, below. Okay, back again, back to some gas again, yeah. Face up, okay. Count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, out again, because this is 5%. It's a high dose, you know, it's not as if it's a low dose. Yeah, as much to the ear as possible, where I'm going to cut the right ear, then I have to flush the left ear, so the ear, more to the ear. Where's the ear? So I'm already the ear. Okay, then we check the ear, any warts or not. I think it's a bit too weak already. I think it's better not to do anymore as the ear is concerned. I would say the left ear is okay. Left ear. Any parts coming out? No. It's pretty good. Now look at the right. Examine the right ear. Right ear. Right ear, you can see there's a swelling here, there's swelling here, so there could be a subcutaneous pus, and then this part you can see here. So now I'm checking the pouch, checking the eye first. Eye also, there's a pimple. There's a pimple there. Now this one is not obvious because this swelling is probably an abscess. It's not very obvious. Okay, so now I'm going to give some gas because of the waking up already. Some gas again. So I count to 10. 1, 2, 3. Of course you see whether the hamster is moving or not. 4, 5, 6, 7, 8, 9, 10 is still moving, so you will wait a while again. As long as once it stop moving, which is about now, yeah, there, it stop moving, but not entirely 100% stop. Okay, now let me see. I'll put the ear drops in and check the ears. Which the owner say is true. There is actually a exudate, we call it crusty ears here. This is the cause of all the problems. So I would see whether I can go further in to the horizontal canal, and is he awake? No. So check the canal. It's definitely swollen and full of pus. Open up. There is the vertical canal is here. So see whether I can cut it off. I open up the vertical canal. To get drainage here, to provide drainage of the pus. Okay, open up. Now there's some pus here, you can see there. I will put some gas first because it's awake. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Still moving. be some bleeding, but you can see it's open up. And there's pus coming out from here, there. These are the pus, the subcutaneous. Fat of pus, yeah. Okay, I will put back again because it's awake. So very patiently you do. If not, then if you give injection, it's very hard to survive. Plus the healthier hamster, I give an injection. Save the trouble of going up and in and out. You see, in, out, in, out. So once you stop moving, then that's it. You cannot wait too long there. Now we concentrate on the right ear because the complaint is the right ear. So there's no point going into the left ear. Now I open up the canal already. The vertical canal. See, it goes in the cheek pouch. It's where the pus might come from. Okay, I put the eardrops to irrigate the ears, as in the dog, yeah. But I do both sides because this side, of course, is okay, but still, sometimes the sand might have gone in. Okay, clean up the eyes. Now you can see the pus inside the eyelids. Yeah. Eyelids has got pus. Now this part is probably an inflamed fatty area, then this part. And now, normally we give injections, but it will be difficult for this hamster to give injections. Yeah. He might not be able to take it. And I'm using hydrogen peroxide to flush. Okay, a bit of gas again. He's awake. He's awake. The what? Okay. No. A bit more. A bit one more time. I'm going to do it. It's quite stressful, yeah, to them. Okay. No. It's quite bloody. So to express the pus, quite deep in here. Take the teeth also. Pouch, see whether any infection. There's some infection here and there. Compared to the right side, the left side is okay. So overall, this is the drainage part. It's very small. Yeah, it's a very small area. Then this is the fat which has been infected. Yeah. So I expose the canal and let the ventilation be there. Okay, finish. So I put it back here already. No more. Okay, finish. So we're checking for whether the front teeth are overgrown or not, because he's losing weight. But just now we checked, the teeth are very short actually. They're very short. So there's no overgrown teeth. Yeah. So the reason for the weight loss could be due to infections, bacterial infection. No, okay, this one we saw already. Up and down first. Let's see if he can walk or not. Can you walk?
Can.
We will wait till tomorrow. Just let him relax first. You can't tell till tomorrow. You have to give him the bed through. Orally tomorrow, everything tomorrow.